Neurotrophic Keratopathy, and you can tell from the name that this is a pathology of the cornea. But what about the term neurotrophic? Neurotrophic basically refers to nerve growth factor, and within the name, the pathogenesis is hidden. Neurotrophic or neurotrophic keratopathy basically develops because of a deficiency of nerve growth factors. And where do the nerve growth factors come from? Obviously, from the name you can tell, they basically come from the nerves. Therefore, central to the pathogenesis of neurotrophic keratopathy is impaired corneal innervation, which will be reflected by a reduced corneal sensitivity. There are many etiologies behind the pathogenesis of neurotrophic keratopathy. First of all, starting from the level of the trigeminal ganglia, whose nerve is basically responsible for the innervation of the cornea of the eye. If the trigeminal ganglia is damaged, which is quite frequent during surgery, especially when an alcoholic block is administered before trigeminal neuralgia surgery. Similarly, the fifth nerve can be damaged near its site if the patient has a cerebellopontine tumor. And the most common cerebellopontine tumor is basically the acoustic neuroma. So if there is an acoustic neuroma, there is a risk that it will impinge on the origin of the fifth nerve, and when the fifth nerve is damaged, evidently the branches supplying the eye will also be damaged, and there will be a deficiency of nerve growth factors. Similarly, there can be a systemic condition like diabetes mellitus, which has far-reaching consequences on many structures of the body, and obviously diabetes mellitus does not spare the nerves, because we know there is something called diabetic neuropathy. Similarly, there are certain diseases of the eye which can also cause neurotrophic keratopathy, and the most important one is herpes zoster ophthalmicus. Even though herpes zoster ophthalmicus is because of lesions in the cornea, these lesions can damage the ciliary nerves, which are the last branches which basically innervate the cornea. Also, during ocular surgery, the innervation of the cornea can be damaged, and most notorious for this is LASIK surgery for the correction of the refraction of the eye, the refraction errors of the eye, as well as keratoplasty, specifically full thickness keratoplasty known as penetrating keratoplasty. In order to understand the clinical features, I have this image of, you know who this is. This is Kakashi from Naruto. And the important thing over here is that this image is misleading, so don't go by this 100%. Obviously, he is in pain right now, but this is a painless condition which is characterized by red eye. ठीक है ना? Painless red eye with reduced lacrimation, whereas obviously right now the tears are overflowing. ठीक है? So painless red eye and reduced lacrimation. There is also in general a decrease in visual acuity which accompanies most keratopathies, as well as epithelial defects and ulceration, which is why we have this in the keratitis topic, in the corneal ulcer topic. And because of the ulceration, the barrier is damaged, it can lead to secondary infections. What about the treatment? First of all, we want to nip the problem in the bud, because the problem is a lack of nerve growth factors. The application of topical nerve growth factors is one very important modality. Similarly, the reduced lacrimation or the reduced production of tears is something we need to resolve, and we do so using stuff like autologous serum or using other topical forms of lubrication like synthetic tears. Similarly, we need to ensure that the ocular surface is protected, because it is vulnerable now because of the lack of a tear film. And there are many ways of doing that, including the use of a conjunctival flap or an amniotic membrane flap, or maybe a surgery like tarsorrhaphy in which the eyelids are closed. So basically stuff like that. So we want to resolve the problem at its core by giving the nerve growth factors, and we want to protect the eye via lubrication and via protection of the ocular surfaces. Similarly, we want to stop the spread of this condition by giving topical anticollagenase like acetylcysteine and systemic anticollagenase like the antibiotic, or specifically the antibiotic tetracycline. Similarly, in addition to the pathologies or the etiologies we've already considered, certain medication contain toxic preservatives which can be a cause of neurotrophic keratopathy. So if someone is using benzalkonium, that needs to be discontinued effectively.